Now we'll officially start our meeting with the Pledge of Allegiance. If you join me.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you. Different than previous meetings, as we have gotten started, I'll call this meeting of 4/1, April Fool's Day, 2020, to order. And in previous meetings, we had to dismiss Mr. Humphrey from the meeting, and today is an exception. Mr. Humphrey is with us in a virtual setting and is teleconferenced in today. And I just wanted to touch that this is allowed by House Bill number 197 that was provided by the 133rd General Assembly. It's a broad-reaching piece of legislation enacted in response to the COVID-19 pandemic in the spring of 2020. The legislation makes numerous changes in local government operations in response to this outbreak. One of those changes, including the act, is the provision which authorizes members of public bodies to attend meetings by hearings by means of teleconference, video conference, or any other similar electronic technology. This temporary law change was sought by the County Commissioners Association of Ohio and other local government organizations to reduce in-person meeting attendance, thereby lessening community transmission of the COVID virus. So I would welcome Commissioner Humphrey. Commissioner Humphrey, are you there?
Yes, sir. Thank you very much.
We're glad to have you today by teleconference.
Thank you.
You bet. And those who are watching by live stream, we welcome you to today's commissioners meeting. And I would go right to B on our agenda, approval of the regular session minutes of 3/25/2020. Board members have had them in advance, had an opportunity to review them and have any changes addressed. Do I have a motion to approve the minutes of 3/25/2020?
So moved.
I'll second that motion.
I'm sorry, Mr. Humphrey, you were absent from that meeting on March.
Thank you.
You're
All right.
welcome.
That's all
For
right.
the correction. I'll make that motion.
And I'll second that motion. Any conversation or discussion? Roll call, Judy.
Mrs. Corcoran,
Yes.
Mr. Painter,
Yes.
Mr. Humphrey.
Abstain.
Thank you, Ed.
Judith.
We've completed with the approval of the regular session meeting minutes, and as always, I'm going to move county staff and elected official discussions up to this particular point of the agenda. I know that we have Pam Hovercloss of our EMA department and also Julianne Nisbet of Public Health. And could I call on one of you to give us an update first? Pam? Pam is here. Morning, Pam.
Hi, how are you?
Fantastic.
Good morning.
If Juliana's on, I'll turn it over to her to give a public health update, and then I will give an update on what we're doing in terms of emergency management.
You bet.
Good morning, everyone.
Good morning, Julianne.
Thank you. So we have 11 confirmed cases in Clermont County currently. I do want to talk a little bit on a couple things that we just want to make sure the public is aware of. We know what we're seeing right now is really from weeks prior to that's going on. So I do want to really stress that the social distancing requirements that we're implementing right now across the entire state, the importance of this is really, it's going to have an impact, 7 days from now, 14 days from now, in what we're doing. So I know sometimes for people it just may feel restrictive and that we're not necessarily having an impact, but we are. And we, unfortunately, the way the numbers roll, we may not necessarily know how much, but we know from what we're seeing in other places across the country and across the world, that ultimately we do feel like we are starting to push that curve out and to flatten it a little bit. And it really gives us additional time to ramp up resources within the hospitals and our healthcare systems. And then the ever so important concern with personal protective equipment that we simply aren't going to have enough to be able to go around. There obviously are some new technologies that are helping us with that. But we really do want to stress for the public that what we're doing now is really having an impact on the future that we're gonna have. And we really need people to abide by those social distancing requirements that are in place. I do want to make note, we are still receiving numerous kind of calls and information on essential businesses. Pam can talk a little bit more because they are taking the initial calls for us to try to get a little bit of that burden off of public health. They then kind of sort through them. Some of them are very simple things they can answer, and then we have a team here who takes some of those and will respond out to them for what's going on. But what I'd really like to convey to the public is if you have questions about your employer, the first thing you need to do is go talk to your employer and really have a conversation with them about, you know, how they're being deemed as an essential business and making sure they're putting the requirements in place for social distancing. We want you to do that first so that they're aware of your concerns. If you have done that and you're still not getting headway, then of course feel free to call in and we will look into it. For those businesses that are being deemed as essential on it, we still want to make sure they have to abide by the social distancing requirements. So while they still may be able to be open and functioning, they still have to, particularly for employees, make sure that they're doing 6 foot of social distancing, making sure they have, you know, soap and paper towels for them to wash their hand sanitizer in place for that. They should also be posting for their vulnerable populations, you know, such as our elderly, when there are specific hours set aside for them to be able to come into facilities, particularly for grocery stores and things that they need in their homes. And then making sure that that information is available online where people can contact them, find out what their hours are, if they're different, or how somebody may be able to reach out to them to make sure that people are being protected. Those are, I think, some of our key things for now. We do anticipate that we will continue to see increased cases as we go along. We are still struggling with testing. We know that. Not everyone is necessarily being tested, and I just want to reiterate what I have said before, that testing does not change treatment. So if you contact your physician and they choose to not test you, that does not change in any way, shape, or form how they treat you for the illness on it. So please reach out to your healthcare provider. It's their decision to make on whether or not they choose to test you or to do things to rule things out, or whether they test you to treat you, or whether they just assume that the coronavirus or COVID-19 is what you have, and they still recommend treatment that way. So we are starting to see some additional, you know, tests roll in. We were anticipating increases in our confirmed cases. We know not everyone is being tested. You know, we know that it's just the capacity is not there yet. We again are watching with everyone else as they're trying to develop new technologies for quicker testing, rapid testing. You know, we're all eager to see those solutions also. But as of today, we still know that there are difficulties with people getting tested, and then really the test results that are coming back on it. There are still lags in test results that come back from private labs. We see that, and then we are doing our best to try to get as many samples to go up through the state lab as we can. That is really all I have for right now, unless anyone else has questions, and I'll be happy to stay on the line through Pam's discussion also if there's any additional questions.
Julianne, just a question. Of the people who have actually been treated for COVID-19 in Clermont County, I know you might have put that number out there. How many have recovered from that particular diagnosis?
So of the, I'm gonna have to actually, I can tell you that right now when I go and click on our website. So for that information is actually right on our website for those of you, and I need to get today's numbers and see if they've been updated yet. I've been in conference calls, so hold on 2 seconds. So we have, and actually our website will update around 2 because the website has 10 confirmed cases. I have 11 currently on it. We have 2 hospitalizations. 6 of those have resolved. So we put that information right up on our website. And then we try to also keep the Ohio information tracked up there so it's in one place where people can go to be able to take a look at that information.
Okay. Pam, are you next?
Sure. So I'm Pam Haverkos. I'm the Clermont County Emergency Management Agency Director. As Julianne mentioned, we're partnering with public health to support them through this incident. We're also collaborating and coordinating with all of our public safety agencies to make sure that we're on the same page, that we have the same information. So we have daily Zoom conference calls with all of our public safety agencies. As Julianne mentioned, our office is taking all of the public inquiries and emails as it relates to questions on essential businesses. So if anyone has a question or a complaint or would like to voice some concern, they can email us at Clermont, CLERMONTEMA, at ClermontCountyOhio.gov, or they can call our office at 513-732-7661. They can also email or call us if they have any questions on that they don't know who to call directly. So if they just need a resource referral or have a question that they can't answer through some other means, they can call us and we can help direct them to the appropriate agency or social service agency if it's a need. So we're not only coordinating with our public safety agencies, we're also coordinating with our social service agencies. We've established an unmet needs committee. Again, we're having conference calls versus physical meetings. We meet with our social service agencies weekly to identify any gaps in our communities that need to be addressed, and we're working to coordinate that. We're also looking forward into the future and looking at what a week or 2 weeks from now looks like as we kind of get more into that surge. And we're working with our regional partners, so our other county emergency management agencies, our other county public health departments, our hospitals, to make sure that we have a medical surge plan. If you guys have listened to the governor's press conferences, he discussed, I believe it was Friday, that he had reached out to all the healthcare coalitions to draft a regional medical surge plan. So for us, the Health Collaborative is our coordinating agency for our regional healthcare coalition, and they submitted a plan up to the governor on Saturday, and it's in the process of being finalized, and they'll be rolling that out. And then once we get that plan and it's finalized, we'll be working on how do we make sure that we are responding appropriately in the county to take any influx of patients to those what they're deeming alternative care centers. Again, that's as we reach that capacity at our local healthcare facilities and our local hospital, it would be to address that gap in service. So we are actively working to make sure that we're prepared and can respond to and have the appropriate resources to be able to provide those services to our residents. I did have a couple things that I would like to just remind people. I know we can tell by the call volume and call inquiries that we're receiving that the public is getting anxious and there is an escalation in people's concerns. So if anyone would need mental health support or would like to talk to somebody, please reach out to 513-528-SAVE, which is operated through the Mental Health and Recovery Board, and they can assist you. Again, we want to make sure that everybody has the appropriate support throughout this very trying time. Let's see here. I think that's it. Again, we're coordinating not only with our local public safety agencies, we're coordinating with our local municipalities, we're coordinating with our social service agencies, just to make sure that we're all have the ability to continue to provide services to the public as the need arises. The one thing we didn't mention is that we are still continuing to reach out to the public and to all of our professional agencies that have shut down their operations, and we are continuing to do personal protective equipment drives. The Public Health Department has coordinated to do a PPE donation drive for tomorrow, which is Thursday, from 10 a.m. to 2 p.m. So if anyone has any personal protective equipment, hand sanitizing supplies, sanitizing equipment, so wipes, sprays, and they want to drop off that equipment, we will gladly take it. It's at Permit Central from 10 to 2, which is 2275 Bauer Road. Again, you don't even have to get out of your car. Public Health will be there to take your donations, and we greatly appreciate that. And then we have a committee that is looking at all of our public safety needs, or our PPE needs, and we're trying to allocate those donated supplies to our public safety personnel who need them moving forward. So again, those donations will stay in the county, and they will greatly help our public safety agencies moving forward. So anyone that has donated or continues to donate, we really appreciate that effort.
Anything else?
Any questions?
Pam, thanks so much for being here today. Julianne, thanks for being on the call today. You know, I know, like you've already identified, the citizens of Clermont County, I mean, you can start to feel that there's a concern there. I mean, one of the things that, you know, we're going to spend a lot of time with this particular issue this morning in today's meeting. We want to make sure that the public understands that, you know, we have the best professional people here at Clermont County with their finger on the pulse of this COVID-19 epidemic, and that we're doing everything we can to prepare and to prevent the spread of this virus. Just to reiterate a couple of things that you guys have said, the suggestions are focus on doing the right thing and continuing social distancing. What people are doing now makes a difference 2 weeks from now. Julianne talked about that. It takes time to flatten that curve, so continue the actions we're taking and abide by social distancing. Help your neighbors, check on the elderly, and be kind to each other, obviously. Don't panic. Don't panic. Keep moving in the right direction. And I also just wanted to talk a second about the president's coronavirus guidelines that he issued for America. And the title on that was 30 Days to Slow the Spread. And just Pam, feel free. He stated some guidelines to listen to and follow the directions of your state and local authorities. If you feel sick, stay home. Don't go to work. Contact your medical provider. If your children are sick, keep them at home. Don't send them to school. Contact your medical provider. If someone in your household is tested positive for the coronavirus, keep the entire household at home. Do not go to work. Don't go to school. Contact your medical provider. And if you're an older person, stay home and away from other people. And if you're a person with a serious underlying health condition that can put you at increased risk, for example, something that impairs your lung function or your heart function or weakens your immune system, stay at home and stay away from people and continue social distancing. Anything to add to that?
I think that's pretty representative of what we're asking the public to do today. And again, if anyone has any questions or they need assistance and they don't know who to contact, please call our office and we will connect you with the appropriate agency. Again, that number is 513-732-7661. And our email is clermontema@clermontcountyohio.gov. If we don't answer the phone, so our phones will be manned from 8 to 5, but if we don't answer the phone, leave a message and we'll get back with you as soon as possible. And again,
Okay.
thank you for your time today.
Thank you. Thank you. And with that, staying on the coronavirus, a couple meetings ago, Commissioner Corcoran had requested that a flyer go out to the citizens of Clermont County. The concern being that there might be those who are not connected as far as social media and other means to get information. So, David, if you could show the card there. There will be a flyer coming to households, about 70,000 households in Clermont County. That flyer is stated and says, to the citizens of Clermont County, we want to make sure that you have the latest, most accurate information about the COVID-19. We encourage you to call, email, or visit the websites that are listed below. We're proud of the way that Clermont County is pulled together during this extraordinary time. Please take advantage of what the county has to offer. And obviously, it's signed by the Clermont County Board of County Commissioners. And Commissioner Corcoran, if you would just go over some of the contact information that's on there for those who are listening or joined us by teleconferencing.
The Clermont County Public Health can be reached at ccph@clermontcountyohio.gov. the Ohio Department of Public Health, and that's the main number we really want you to call to take the pressure off of our local agencies. And that is 1-833-4.ask.odh, and that is 1-833-427-5634. The Clermont County Senior Services phone number is area code 513-724-1255. There's also a site for them at info@clermontseniors.com. The Southwest Ohio Council on Aging, the phone number is area code 513-721-1025. Clermont County Government can be reached at 513-732-3000 at clermontcountyohio.gov. And some food sources have special hours for our seniors. We ask that you take advantage of that, and people with chronic health conditions that do not need to be exposed to others. Please call your preferred grocers for those set-up times, and usually they're very early in the morning. In addition to that, Pam gave us the information on the Mental Health and Recovery Board, and that is area code 513-528-SAVE. At this time, we appreciate everyone. If you received this in the mail, please don't throw it away. Put it on your refrigerator or somewhere where you can have access to it. And on behalf of the Communications Department, I'd like to send out a great big thank you for getting this up and ready so quickly. And it will be reaching your doorsteps, hopefully, and in your mailboxes by Thursday, which is tomorrow, or Friday. So hang on to these cards. They are a great resource. Thank you.
Thanks, Commissioner Corcoran, for making that suggestion, and thanks to the staff and those who worked on that here in Clermont County. Mike, I know that was a tough, Mike Bowman, I know that was a tough ask, and it was a short time frame, so appreciate everything that you did to make that happen. Okay? Thanks. And now, if Commissioner Corcoran, if I could take the podium for a second.
Please do. It's yours.
Obviously, this is a trying time for Clermont County. I wanted to take the podium this morning just to provide some information and have a conversation with those citizens here in Clermont County to ensure that we have a good pathway set up here for communications. I'm Commissioner Painter. I want to talk to you this morning about limiting the spread of the COVID virus by practicing a particular acronym that in the industry I worked in is called ALARA. And ALARA stands for as low as reasonably achievable. Something that you may not know about me, but prior to becoming a commissioner here in Clermont County, I worked a 40-year career in the nuclear industry. As you're aware, radiation is something you can't see with your eyes, but you know it's there. Safety was always the first priority when we accomplished any work. The work plan we used identified factors to mitigate or limit your exposure to hazards. Those controls included eliminating the hazard when possible, and when that wasn't possible, we used engineering, administrative, and PPE, or personal protective equipment, in that order of importance as I just listed it to mitigate those hazards. We always relied on our PPE as a last resort. The ALARA principles were always included when planning and executing work. If you limit the time you're exposed to a hazard, put the greatest amount of space that you can between you and that hazard, and then shield yourself from the hazard when you can, then you've used ALARA principles as low as reasonably achievable. The practice increased your safety envelope to work in and lowered your exposure, as I've already stated, to as low as reasonably achievable. Time, distance, shielding, hazard elimination, engineering controls, and administrative controls, and personal protective equipment. Although the COVID-19 virus is very different from radiation and its hazards, it can be managed in the same manner. And you've heard some of those principles here today that Pam and Julianne have talked about. So let's review what I just said. You can't see the virus, but you know it's there. If we stay at home, then we can limit the time that we're exposed to the virus. If we practice social distancing, we can put the greatest amount of space between us and the virus. Finally, if you put an object between us and the virus, say a service window when possible, you've practiced those ALARA principles. The only other control that we haven't included or I haven't talked about today is PPE, personal protective equipment, respirators, gloves, and eye protection. Now, just because I mentioned these items, please don't hoard those items, because our first responders and medical workers on the front lines need them, and there's a severe shortage of those. So if you have extras, you've heard Pam talk today about having a PPE drop-off, and by all means do that. But if you do have them, and you have those particular items laying around, and in my particular case, I'm an allergy sufferer, so I have a particular respirator that I keep in my workshop that is used for dusting conditions and is obviously used sometimes cutting the grass. Then if you have to go out, use it. An N95 respirator, gloves, latex or nitrile, goggles or safety glasses, they're all good options. If you've identified the hazard, and we have, limit your exposure to it, distance yourself from it, shield yourself from it when it's available, like for instance, drive up windows at your car, and you wear the proper PPE, then you're following the ALARA principles. If you work to keep your exposure as low as reasonably achievable, then your safety window is increased, and so's your family's. Safety, well, it's everyone's responsibility here in Clermont County. We're in a critical window this next 30 days. Follow these ALARA principles. The safety of our citizens depends on you doing your part. Thank you. Tom, anything else about the COVID-19 path forward today?
Yes, sir.
Commissioner Humphrey? Claire?
Nothing. Thank you.
All right.
I'd like to emphasize what you've said. We need to keep our distancing, our personal distancing, not our physical distance, not our personal difference. We need to be able to chat with people, make telephone calls, check on your neighbors. All of that is critically important. And by putting this off, by having social distancing now, and we have had in the past, we'll lower the curve, as they've talked about. So we won't run out of personal protective equipment for our responders and our hospitals and our nursing homes nearly as quickly. And new drugs will be able to be found, and we'll be able to have treatments that we don't have now. And we've seen that in treatments, and we've seen that in the ability now to clean the N95 masks. So I think if we can put this off, we will reduce our risk, and the ALARA principles will apply. Thank you.
Thanks, Ed. Thank you. So tattoo that on your chest. ALARA works, as low as reasonably achievable. And with
I
that,
don't think I'm going to do that.
you might. With that, we'll move on with the agenda.
Mr. Mayor, we do have our engineer, Jeremy Evans, who would like to give us an update while we're under elected official discussion.
Absolutely. That'd be great. Jeremy, you on?
I am.
Morning.
Morning.
Good morning. I just want to give everyone a quick update on our Price Road Bridge project in Miami Township. It was almost exactly a year ago that the bridge was damaged and then closed. Fortunately, we were able yesterday to get that reconstruction completed for the most part and reopened. There'll be a little bit of extra work to do, some odds and ends, but the road is open. So that's good news. I wanted to point out too that as unpopular as the governor's fuel tax increase was last year, that we wouldn't have been able to move forward as quickly as we did without that. Those funds started to roll into the local level around September of last year, so we were able to get that bridge designed and out to bid pretty quickly. They started construction in December. They worked all through the winter, and we're able to get that opened again yesterday. Without those additional funds, we wouldn't have been able to start that project until this year, and that may have been one of the only bridge projects we did this year. So I think it's important for people to understand where those tax dollars are being spent, and I wanted to let everyone know and share the good news that that road is reopened.
Fantastic, Jeremy. I know that was a bridge that required a lot of drive around, correct?
It did. It was quite a lengthy detour.
You bet. Well, thank you. Thank you for diligently getting on that challenge and getting it done for the people of Clermont County. We appreciate all that you do.
No problem. Thank you.
You're welcome. Anything else, Tom?
Yes, sir.
All right. Then we will continue with the agenda. C, a consent agenda. A consent agenda was provided for the board early. You've had an opportunity to review it. Are there any particular items that you would like removed from the consent agenda for further conversation or discussion?
None.
Mr. Humphrey, none?
None, thank you.
Okay. Then I'd ask for a motion to approve the consent agenda as submitted.
I will make that motion.
I'll second.
Been moved and received a second. Any further conversation or discussion? Roll call, Judy.
Corcoran.
Yes.
Mr. Humphrey.
Aye.
Mr. Painter.
Abstain. Item D, non-consent agenda. Non-consent agenda starts on page 4, starts with item number 9. Recommendation, the Board of County Commissioners adopt Resolution 046-20 resolving to approve payments and vendors in the revised total amount of $1,203,404.59 as set forth in the BCC approval invoice report for checks dated April 1, BCC directed paid invoice report for procurement card transaction report as presented by the county auditor on 3/30/2020, and further authorizing the county auditor to issue warrants for the same pursuant to 319.16 of the Ohio Revised Code. Do I have a motion to pay the bills?
I'll make the motion.
Second.
It's been moved and received a second. Roll call, Judy.
Corcoran.
Yes.
Mr. Humphrey.
Aye.
Mr. Painter.
Yes. Item 10. Hello there, Mr. Dick.
Good morning, Commissioners. Item number 10 is a recommendation of myself, Timothy Dick, Director of Department of Job and Family Services, with the concurrence of Thomas J. Eigel, County Administrator, to appoint the following representative to serve on the Clermont County Family Service Planning Committee for the term beginning April 1st, 2020 through March 31st, 2022, for the purpose of gathering public input and reviewing and making program recommendations and developing and maintaining a community plan to implement Ohio Works First, pursuant to and in compliance with Section 329.06 of the Ohio Revised Code and other programs established under Chapter 5107, which is Ohio Works First Program, and Chapter 5108, Prevention, Retention, and Contingency Program of the Ohio Revised Code. The recommendation is Nathan Oder, who resides in Cincinnati, Ohio, 45244, as a Clermont County resident, and again, the term is April 1st, 2020 through March 31st, 2022.
Board, you've heard the reading of item number 10. Do I have a motion for approval?
So moved.
I'll second.
It's been moved and received a second. Any further conversation or discussion? Roll call, Judy.
Mr. Humphrey.
Aye.
Mrs. Corcoran.
Yes.
Mr. Painter.
Yes. Item 11. Thank you.
Thank you.
Morning, Lyle.
Morning. I'm Lyle Bloom, Director with the Clermont County Water Resources Department. And item 11 is a recommendation to adopt resolution number 047-20, resolving to amend resolution number 017-19, which is determined to make improvements relative to the construction, operation, and maintenance of the of project number 6402-60141 relative to the Locust Lake Lift Station and Conveyance Improvements Project located in Batavia and Pierce Townships. This is previously adopted by the board on February 20th, 2019, and further determining to make the four stated improvements as set forth in the revised Exhibit A, which is attached, and to proceed with therewith in accordance with the detailed plan, specifications, and revised estimate of cost and financing, all of which shall be paid from one or more of any combination of the wastewater replacement and improvement fund, wastewater capital improvement fund, any portion of any federal or state grant or loan, should such become available, and or by the issuance of notes or bonds pursuant to section 133.08 of the Ohio Revised Code, and payable from revenues derived from sewer rates and charges levied for the operation of the Clermont County wastewater system, and subsequent thereto, to approve the request to re-advertise for bids for the project pursuant to the specifications and plans, and to authorize the clerk of the board to place a legal notice in a newspaper of general circulation on Thursday, April 9th, 2020. Schedule a non-mandatory pre-bid meeting on Monday, April 23rd, 2020 at 10 a.m. with bids to be received until 2:00 p.m. local time on Thursday, April 30th, 2020. Here in the office of the Board of County Commissioners, they will be publicly open and read aloud shortly thereafter. And this notice will also be posted on the county's website. So this is for installation of a new 8-inch force main that we're proposing to be directional drilled. It's about 7,100 feet of new force main, plus a new diesel generator at the lift station. The engineer's estimate on the project is $1,760,000. We've actually this will be the fourth time we've bid this project out. In other attempts, we have either had a bid that is too high, it's not within the 10%, or we've not received any bids at all. So we've modified the engineer's estimate, and then we've opened up the construction schedule a little bit to hopefully make it a little more attractive to contractors. Maybe with the change in the economy too, there'll be more interest from directional drilling contractors.
Okay, you've heard the reading of item number 11. Do I have a motion for approval?
I'll make the motion.
Second?
It's been moved and received a second. Any further conversation or discussion? Well, this is a pretty good-sized project.
Yes.
That's a lot of feet.
Yeah, the majority of it's in the roadway, which is the primary reason why we're directional drilling. There's a lot of other utilities. It's going past 2 elementary schools, so it's a busy area right through the former village of Amelia.
Okay. Anything further? Roll call, Judy.
Mrs. Corcoran.
Yes.
Mr. Humphrey.
Aye.
Mr. Painter.
Yes. Item number 12.
Item number 12 is a recommendation to execute the Fourth Amendment to the contract for professional services between the Board of County Commissioners and Turan Corporation out of Beaver Creek, Ohio. This was previously ratified by the board on February 20th, 2013, and then amended on December 14th, 2016, and September 13th, 2017, and March 28th, 2018, for additional professional services in and as it relates to the data management system for the Aber Road facility of Seacoast International, and assistance with a long-term data collection and analysis program, therefore, as well as evaluation and monitoring of the groundwater at the PUB well fields in conjunction with the closing of Duke Energy's Beckjord power generation station, and the unknown status of the disposition of the ash ponds relative thereto, in accordance with the revised 2020 scope of work, which is identified as Exhibit A, and updated 2020 hourly schedule of fees, which is identified as Exhibit B, and attached to this, and represents an increase in the amount of $45,000 for a total revised contract amount not to exceed $155,000, with all their terms and conditions of the contract and amendments to remain in full force and effect and contingent upon the release of the purchase orders.
Board, you've heard the reading of item number 12. Do I have a motion for approval?
I'll make the motion.
Second?
It's been moved and received a second. Any further conversation or clarification? I'll just talk a second about Seacoast and Beckjord, just a little overview.
Well, of course, Seacoast is the hazardous landfill that was closed many years ago. And we've been evaluating that. We have groundwater, surface water sampling, and that we conduct ourselves. And then we also collect their data, they report data, and we get copies of that we evaluate, and Turan Corporation helps with that data collection and evaluation. Likewise with Beckjord, we've been monitoring, collecting the monitoring data from the Beckjord facility since I believe the early to mid-90s, when there was a sulfate plume detected that impacted our well fields. We get those quarterly reports. Turan Corporation helps evaluate the data in those reports, and they will also they can look at groundwater modeling as well to help evaluate the movement of the groundwater and if it could actually impact our well fields.
Okay, thank you. Nothing further? Roll call, Judy.
Mrs. Corcoran?
Yes?
Mr. Humphrey?
Aye.
Mr. Painter?
Yes. Item number 13.
Item number 13 is a recommendation to first award the bids for contracted services to perform lawn mowing and lawn maintenance of Clermont County properties pursuant to the specifications to Tyndall's Lawn and Landscape out of Batavia and Sullivan Services LLC out of Cincinnati for their lowest and best bids received on February 13th, 2020 as follows. Tyndall's Lawn and Landscape, they bid for the bid item number 1, which was for the water properties for $22,960. Sullivan Services was the low bid for bid items 2 and 3, which are wastewater properties and other county properties. For the wastewater properties, it was $35,140, and for the other county properties, it was $17,080. For the total annual estimated cost for all 3 contracts of $75,180. And 2, to execute the contracts for contracted services to perform lawn mowing and lawn maintenance of Clermont County properties between the Board of County Commissioners and Tyndall's Lawn and Landscape in the annual estimated amount of $22,960, and Sullivan Services in the total amount of $52,220. This would be effective for the period of April 2nd, 2020 through April 1st, 2021, and by mutual agreement of the respective parties in writing, exchanged not less than 30 days prior to the expiration. The contracts may be extended for an additional 1-year period upon the same terms and conditions as stated in Article 8 of the contract, pursuant to and in compliance with the terms and conditions set forth therein, and award of bids therefore, and contingent upon of the release of the required purchase orders. So this is for mowing of our wastewater treatment plants, a few lift stations, our water treatment plants, our elevated water towers, and then county properties that Wade Grabowski is responsible for the maintenance of as well.
Board, you've heard the reading of item number 13. Do I have a motion for approval?
So moved.
I'll second.
It's been moved and received a second. Any further conversation or discussion? Roll call, Judy.
Mr. Humphrey?
Aye.
Mrs. Corcoran?
Yes.
Mr. Painter?
Yes. Item 14.
Item 14 is a recommendation to award the bid for electrical maintenance and repair of water and wastewater treatment plants and appurtenances for the Clermont County Water Resources Department pursuant to the specifications to Glenwood Electric Incorporated out of Walton, Kentucky for the lowest and best bid received on February 13th, 2020, and the estimated total annual amount of $89,260 effective for the period of April 1st, 2020 through March 31st, 2023, with the option to renew for an additional 1-year period upon the same terms and conditions pursuant to and in compliance with the terms and conditions set forth therein, and award of bid therefore, and contingent upon the release of the required purchase order. So this is just a contract within a company that does electrical maintenance and repair, and it supplements our existing staff.
Okay. Board, you've heard the reading of item number 14 for electrical maintenance and repair. Do I have a motion for approval?
I'll make the motion.
Second.
It's been moved and received a second. Any further conversation? Roll call, Judy.
Mrs. Corcoran?
Yes.
Mr. Humphrey?
Aye.
Mr. Painter?
Yes. Item 15.
Item 15 is a recommendation to authorize David L. Painter, President of the Board of County Commissioners, to execute a release of all claims between the Board of County Commissioners and James W. Heskamp, doing business as 3210 Alpine LLC, in the amount of $2,404.50, which represents the total cost of the repairs to property at 3210 Alpine Terrace in New Richmond as a result of the untimely restoration of water service on January 28, 2020, pursuant to and in compliance with the terms and conditions set forth therein.
Board, you've heard the reading of item number 15. Do I have a motion for approval?
I'll make the motion.
Second.
It's been moved and received a second. Any further conversation or discussion? Roll call, Judy.
Mrs. Corcoran.
Yes.
Mr. Humphrey.
Aye.
Mr. Painter.
Yes. Thanks, Lyle.
Thank you.
Item number 16.
Do we have
Ms.
Evans?
Sheets, Mr. Evans,
Jeremy, is she muted?
Suki, your sound's not working.
Real low. It's very faint.
I'll jump in here and try.
There we go.
Let's see, I've got, it looks like 17 on my sheet.
She's,
Resolution number 048-20, resolving to request the State of Ohio Director of Transportation to reduce the speed limit on Laurel Nicholsville Road, located in Monroe Township, as outlined below. This is Laurel Nicholsville Road from State Route 232 to State Route 222, a length of 1.251 miles. It is currently unposted 55 miles per hour.
Board, you've heard the reading of item number 16 to repost Laurel Nicholsville Road. Do I have a motion for approval?
I'll second.
It's been moved and received a second. Anything further? Roll call, Judy.
Humphrey.
Aye.
Mrs. Corcoran.
Yes.
Mr. Painter.
Yes. Item 17.
This is a recommendation to adopt resolution number 049-20, resolving to request the State of Ohio Director of Transportation to reduce the speed limit on Newtonsville Road, located in Wayne Township, as outlined below. Again, this is Newtonsville Road from Cross Street to 0.215 miles northeast. It is currently unposted 55. This is a result of the, what's the word I'm looking for? The dissolution, thank you, of the village of Newtonsville. This segment was previously inside the village, so now it's unposted.
Okay. Board, you've heard the reading of the item. Do I have a motion for approval?
I'll make the motion.
Second.
It's been moved and received a second. Anything further? Roll call, Judy.
Mrs. Corcoran.
Yes.
Mr. Humphrey.
Aye.
Mr. Painter.
Yes. Item number 18.
Item 18 is a recommendation from Ernie Ramos, Assistant Prosecuting Attorney, to accept the sum of $912.10 from the Ford Development Corporation. And this is the full settlement of claim resulting from damage sustained to a Clermont County Water Resources Department vehicle on January 22nd, 2020, and to execute the release for property and/or liability damage relative thereto pursuant to the terms and conditions set forth therein.
Board, you've heard the reading of item number 18 for the settlement of damage that was incurred to a county vehicle. Do I have a motion for approval?
So moved.
I'll second.
Been moved and received a second. Any further conversation? Roll call, Judy.
Mr. Humphrey.
Aye.
Mrs. Corcoran.
Yes.
Mr. Painter.
Yes. Item number 19. Hi, Mary Raines.
Morning.
Morning.
Mary.
Number 19 is a recommendation to increase the 2020 annual appropriations pursuant to 570540, the revised code. Two of them are in general fund for retirements at the sheriff's office, one for his administration of $19,356.10, and in court services for $17,880. And the other one is for the emergency management agency to put $2,000 in their overtime budget for this COVID-19 virus.
Board, you've heard the reading of item number 19 for changes to the annual appropriation. Do I have a motion for approval?
I'll make the motion.
Second.
It's been moved and received a second. Anything further? Roll call, Judy.
Mrs. Corcoran.
Yes.
Mr. Humphrey.
Aye.
Mr. Painter.
Yes.
Thank you, Mary.
Thank you.
That concludes the Non-consent agenda as provided. Tom, do we have some additions to the agenda?
We have one add-on at this time for the consideration in the Emergency Management Agency, and this is authorizing the extension of a state-local grant agreement.
Board, you've heard the recommendation for a potential add-on to the agenda today for the extension of a state agreement. Do I have a motion for approval to add it to the agenda?
So moved.
I'll second.
Been moved and received a second. Roll call, Judy.
Mr. Humphrey?
Aye.
Corcoran?
Yes.
Mr. Painter?
Yes, the item's been added to the agenda. And Pam, you're here to talk about that?
Pam Havercos, Clermont County Emergency Management Agency. This item is a recommendation of Thomas J. Eigel, County Administrator, to authorize Pam Havercos, Director of the Clermont County Emergency Management Agency, to execute the state and local agreement extension by and between the State of Ohio, Department of Public Safety, and Ohio Emergency Management Agency, and the Clermont County Emergency Management Agency, previously ratified by the Board of County Commissioners on August 15th of 2018 for the Federal Emergency Management Agency FY17, fiscal year 17, pre-disaster mitigation grant program funding for the 5-year review and update of the county all-hazard mitigation plan required by FEMA for an additional 1-year period effective March 23rd of 2020 through March 22nd, 2020, with all terms and conditions therefore to remain in full force and effect. So the grant that we had is for the update of our all-hazard mitigation plan, which we've been working on for the last year and a half. And due to everything that we're experiencing right now, we've had a delay in getting our updated all-hazard mitigation plan back to the Board of County Commissioners for approval. So we have that slated and in your queue to come back to you for approval. But in order, because of that delay, we just need an extension on the grant so that we can continue until we get the adoption of the plan. The plan has been submitted to both Ohio Emergency Management Agency and to FEMA, and both have approved it. So as I said, it's in the queue to come back to the Board of County Commissioners for adoption. And once it gets adopted, we have a 1-year period to work with our local communities to also adopt it so that they can be included in the plan. The technicality is all villages and cities would have to adopt it. So for us, it would be the city of Milford and then all of our villages. But we'll also work with our townships to get them to adopt it. But again, we're kind of in this process where that has become a little bit of a back burner issue for us at the moment.
Understood, understood. Board, you've heard the recommendation of Tom Eigel and Pam Havercos today for emergency management for the state-local grant agreement extension. Do I have a motion for approval?
I'll make the motion.
Second.
It's been moved and received a second. Any further conversation, Board? Roll call, Judy.
Corcoran?
Yes.
Mr. Humphrey?
Aye.
Mr. Painter?
Yes. Thanks, Pam. Any other add-ons, Tom?
Not at this time, sir.
Okay. I would go again to item G, county staff elected official discussion. Any further county staff or elected official discussion today? Seeing none, I'd close county staff and elected official discussion. And item H, board members, any further comments today about the meeting or
No.
items that we went over?
We all need to just keep our social or our personal distancing is the only thing that I can say is, we need to keep away from other folks and not transmit this disease.
And just one of the other comments is that, there's a lot of information on television here locally in Cincinnati, about financial statuses of obviously counties and cities and government entities. And I just wanted to assure the people of Clermont County that Clermont County government is run and budgeted on a very realistic basis. And that commissioners before me and obviously Claire's here sitting on the board, and Commissioner Humphrey, you've been here for a while. Those commissioners have practiced good, prudent financial responsibilities and have been good conservatives with that, with the investments that they've made in Clermont County. And I just want to make sure that the employees of Clermont County and the citizens of Clermont County understand that these events of this type, not of this magnitude, have been planned for, and that we are in good, stable financial condition.
And Commissioner Painter, on top of that, a big thank you to all of our staff, our county administrator, assistant administrator, communications department, but to all of our employees who've been out there working at home, juggling their family lives, and trying to keep everyone safe. We appreciate you, and we thank you for all your work.
You bet.
Thank you very much, Claire.
And welcome.
Anything else?
Yes, sir. We have a public hearing at 11 a.m.
We do. And that will be item I on our agenda, correct?
Correct.
So we only have a couple minutes. I'll recess the meeting currently and reconvene at exactly 11 o'clock. Thanks for watching today, and we will finish our meeting after this public hearing. We stand in recess. We just have this one. Do we have two for consideration?
That's it.
That's it. Okay.
Judy, Wade is making handmade sanitizer. He brought some up here.
Oh, good.
So why don't you ask him to bring you a couple bottles?
Yeah.
They're like, it's a liquid form. So how are the kids doing in the Packas?
Wade. I hear you are cooking handmade sanitizer, so that would be a good thing.
I inquired some things.
Did you? I tried to, among other things.
The Walmarts and the Mine, they got to know me.
Did they?
Yeah, we're getting gallons of aloe vera.
I couldn't get any at the health food store 2 weeks in a row, and I just gave it up.
Gave it up.
Dead to the end.
We're making.
Oh, that'd be good, because I have none.
Switched over because you can't get hand wipes.
Yeah, no.
We're putting 70% alcohol, 4 ounces per baby wipe, so you can use them as sanitizing wipes.
As opposed to 91%, which is what the recommended amount is.
91% for hand sanitizer.
Yeah.
For wipes that already have the hyperallergenic stuff in them, you can only use 71%.
Oh, okay, good.
We've got the labels, and I'm not inventing it myself, trust me.
You're not?
I've got the backup documentation to cover it.
You have the formula?
Yeah, I've got the formula.
Ready?
Yes, oh, yes. Mhm.
I'd like to call this meeting back from recess, back into regular session, and we'll move on with the stated agenda. 11 a.m. public hearing. My name is David Painter, and I serve as the President of the Board of Commissioners, and on behalf of Commissioners Ed Humphrey and Claire Corcoran, we welcome you to this public hearing. Today, this hearing is for the proposed issuance of hospital facilities revenue bonds of Clermont County of Allen, Ohio, pursuant to Chapter 140 of the Ohio Revised Code, and in concert with the participating public hospital agencies agreement. And it includes the acquisition, construction, installation, and equipping of additional hospital facilities in Clermont County, among other counties, to refund all or portions of outstanding bonds thereto issued to finance or refinance hospital facilities and to pay certain cost expenses incurred with respect of issuance of bonds in compliance with the Internal Revenue Code of 1986 as amended. Just an outline of today's hearing. Obviously, there'll be opportunity to express objections or endorsements of the proposed issuance of these bonds. And Judy, any particular pertinent?
I would just like to indicate that the notification of this publication of this hearing was in the Cincinnati Enquirer on Wednesday. March 25th, as authorized by the Board of County Commissioners on Monday, March 23rd. Dinsmore and Scholl is the attorneys handling this for and on behalf of Bon Secours, Mercy Health. And I was expecting Abbott Thayer from Dinsmore and Scholl, who I've been working with on this issue. However, his spouse is recovering from a bronchial situation, and so one of his associates is here today to give you an overview. And I'm sorry I wasn't notified as who it was, so if you'll identify yourself.
I'm Julia Knesny. Yeah, we told Abbott, stay home, don't go out at all. So I'm with Dinsmore and Scholl. We're bond counsel, as you said, for Bon Secours Mercy Health, which is the successor by merger to Mercy Health, which was formerly Catholic Healthcare Partner. They've changed their name a few times. It's the same group. This bond deal is for $525 million in the state of Ohio. It'll be refunding the 2008 and 2015 bonds, as well as a relatively small new money part, about $100 million. No more than $50 million of the total amount will be spent in Clermont County, but we do expect a likelihood of $2 million being spent at Clermont Hospital. And as you said, this is just pursuant to the tax code. We're just getting basically your permission. So.
I would like to bring to the board's attention that we have received no information or comments from the public or otherwise in and as it relates to this issue, and this would be since 2008. I believe this is the fourth opportunity as we've moved through the change of the names from Catholic Healthcare Partners to Mercy Health to now Bon Secours. So,
Thank you. Thank you. And since we've had an overview of what these bonds are about and moving forward, I'll open it to public comment. If there's anyone here today who would like to comment, wishes to speak, you may do so by raising your hand and coming to the podium to address the board. Is there anyone here from the public or outside this room that would like to come in and express their opinion for or against the issuance of these bonds?
Make sure there's no one.
Okay.
Do you have anybody on, Commissioner Payne, do you have anybody on public viewing?
I will ask that. Okay? And since we are performing this meeting with virtual access, is there anyone that's on the virtual call that would like to make a comment?
They would not have access. They would have to come here in person to participate.
Okay. So they would have to be here in person?
Yes, sir.
Okay. Okay, thank you. Anything further that needs to come before this meeting?
I don't believe so.
Okay. Then we close. Then I would propose that we close the public meeting. There have been no opposition and no comments proceeding before the meeting. Okay? And then I would ask, are there any proposed add-ons for this?
There is, and
Okay.
it is the resolution in order to proceed with the issuance of the $525 million hospital facility revenue bonds by the County of Allen. And she's going to read the document, or I can read it if you'd like me to.
Well, let me add it to the agenda. I would ask for a motion to add a add-on to our agenda today for the a proposed add-on for consideration by the board subsequent to the conclusion of the public meeting that we just had here at 11 o'clock to consider the issuance of these bonds by the County of Allen, Ohio. Do I have a motion to add it to the agenda?
I'll second.
Been moved and second's been provided. Anything further? Roll call, Judy.
Mr. Humphrey?
Aye.
Mrs. Corcoran?
Yes.
Mr. Painter?
Yes. Then we will proceed with the add-on. If you could do the,
I'll be happy to read it for her. She just,
Thank you.
She just
Thank you.
ascertained that, and it's a whopper, so we can bring in all those things.
Okay.
It's the recommendation to adopt resolution number 050-20, resolving to authorize the issuance of hospital facility revenue bonds of the County of Allen, Ohio, Series 2020 bonds, pursuant to the participating public hospital agencies agreement previously authorized by Resolution Number 58-08, ratified by the Board of Commissioners on April 23, 2008, by and among the County of Allen, Ohio, the County of Auglaize, Ohio, County of Butler, Ohio, County of Champaign, Ohio, County of Clark, Ohio, County of Clermont, Ohio, County of Crawford, Ohio, County of Hamilton, Ohio, County of Lorraine, Ohio, County of Lucas, Ohio, County of Mahoning, Ohio, County of Montgomery, Ohio, County of Ottawa, Ohio, County of Putnam, Ohio, County of Seneca, Ohio, County of Summit, Ohio, County of Trumbull, Ohio, County of Warren, Ohio, County of Wood, Ohio, and Bones Secure Mercy Health Incorporated, successor by merger to Mercy Health, with a maximum principal amount not to exceed $525 million. 1, to finance, refinance, or reimburse the cost of the acquisition, construction, and equipping of equipment, real property, and improvements to hospital facilities as defined in Section 140.01 of the Ohio Revised Code at some or all of the following locations within Clermont County: 4440 Glen Estee Withamsville Road, Batavia, Ohio, known as Orthopedic and Sports Medicine; 2055 Hospital Drive, Batavia, Ohio, known as Clermont Physicians Pavilion, the Heart Institute; 3055 Hospital Drive, Suite 335, Batavia, Ohio, known as Mercy Health General and Vascular Surgeons; 720 West Plain Street, Bethel, Ohio, known as Mercy Health Physicians and Bethel Physical Therapy; 1121 Northview, Hillsborough, Ohio, known as Mercy Health Claremont Women's Center; 473 Old State Route 74, Suite 4, Mount Carmel, Ohio, known as Mount Carmel Family Medicine; 3000 Hospital Drive, Batavia, known as Mercy Health Clermont Hospital, LLC; 3020 Hospital Drive, Batavia, known as Mercy Health Clermont Medical Arts Building; 201 Old Bank Road, Milford, known as Mercy Health Center, Milford Family Medicine; and 6746 Dick Glen Boulevard, Goshen, known as Goshen Internal Medicine, each a project and collectively the projects, the initial legal owner or principal user of each project being Mercy Health Claremont Hospital, LLC, Mercy Health Cincinnati, LLC, or Mercy Health Physicians Cincinnati, LLC, each an Ohio limited liability company, or the corporation, or a related party thereof. 2, to refund all or a portion of the following bonds whose proceeds were utilized to finance or refinance hospital facilities at the projects: County of Allen, Ohio Adjustable Rate Hospital Facility Revenue Bonds, Series 2008, Catholic Healthcare Partners, which are made up of multiple series of bonds, and County of Allen, Ohio Adjustable Rate Hospital Facility Revenue Bonds, Series 2015B, Mercy Health; and 3, to pay costs of issuance of the Series 2020 bonds, with a portion of the proceeds of the Series 2020 bonds to finance and refinance hospital facilities at locations outside of Clermont County in the state of Ohio, pursuant to Section 147F of the Internal Revenue Code of 1986, as amended, and further, to authorize other documents in connection with the issuance of such bonds in compliance with the terms and conditions as set forth in said resolution and said participating public hospital agencies agreements accordingly.
Thank you.
Thanks.
You're welcome.
You've heard the reading of the add-on for the revenue bonds consideration. Do I have a motion for approval?
I'll make the motion.
Second.
It's been moved and received a second. Any further conversation or discussion? Roll call, Judy.
Ms. Corcoran?
Yes.
Mr. Humphrey?
Aye.
Mr. Painter?
Yes. Thank you. Anything further to come before the board today, Tom?
We do have an executive session, sir.
Okay. Item number F, I'd request that we go into executive session pursuant to Section 121.22G1 of the Ohio Revised Code to consider the employment compensation of one or more public employees. Do I have a motion to go into executive session?
So moved.
I'll second.
Been moved and received a second. Roll call, Judy.
Mr. Humphrey?
Aye.
Mrs. Corcoran?
Yes.
Mr. Painter?
Yes. We will proceed into executive session. We will return and we will conduct further business. Thank you.
It does a lot.
Okay, we've returned from executive session. We are back in regular
No, sir.
Okay. Any additional comments, Claire, or anything? And.
Nothing from my side.
Okay. Well, with that, then I would ask for a motion to adjourn the meeting.
I make the motion.
I'll second. Roll call.
Corcoran. Painter.
Yes.
Humphrey.
Yes.
And that concludes our meeting for today, April 1st, 2020. And remember, focus on doing the right thing, continue your social distancing. What you're doing now makes a difference 2 weeks from now. It takes time to flatten the curve, and we need to continue the actions that we're taking and abiding by those social distancing requirements. Help your neighbors, check on the elderly, and be kind to each other. And remember to follow those ALARA principles to keep your exposure as low as reasonably achievable. Thank you for attending today's meeting, and for those who watched at Facebook Live at home, thanks for being here with us today. God bless you, and may your family and you stay safe. We'll see you again next week. Thanks.